Hello, my name is Carrie Roberts with the American Cancer Society, and I'll be your host today. This is one in a series of mini recorded webinars that will focus on PSE change. In this webinar, we'll cover PSE change and why it's beneficial. The goal is to help comprehensive cancer control programs understand the PSE approach and its expected results for successful implementation of PSE strategies related to cancer prevention programs. During the interview, we'll discuss what PSE is, the overall PSE framework, Centers for Disease Control's PSE demonstration project, the benefits of using a PSE approach, and resources that can be used to identify evidence-based strategies for policy, systems, and environmental change work. When you hear the words policy system and environmental change or PSE and you think, nope, can't do that, too hard, too expensive, you're not alone. But on the other hand, if any of the following projects sound familiar, such as increased physical activity for school-aged children, implementing smoke-free air laws in community spaces, or increased opportunities for safe physical activity through creation of green spaces, safe sidewalks, walking trails in your communities, well, then you're already working on PSE changes or thinking about working them. To help us better understand PSA change, I would like to introduce Crystal Morwood, the Cancer Unit Supervisor with the Colorado Department of Public Health and Environment. Crystal, thank you so much for joining us today.
Thank you so much for having me.
Absolutely. So Crystal has been with the Prevention Services Division at the Colorado Department of Public Health and Environment since January of 2011. She's worked on a variety of chronic disease initiatives, including Colorado's Comprehensive Cancer Program, Colorectal Cancer Control Program, Cancer Policy, Systems, and Environmental Change Program, the Cancer Cardiovascular Disease and Chronic Pulmonary Disease Grants Program, Cardiovascular Disease Prevention, and various other health systems enhancement efforts. Again, Crystal, thank you so much, and we have a lot of information to cover today. So should we just dive into our questions?
Let's do it.
Wonderful. So first, can you describe for our audience what policy, system, and environmental change is and why it's important?
Sure. Policy, systems, and environmental change initiatives are those that help make the healthy choice easy, or what I like to call automatic health. While behavior change and choices are critical to address chronic disease prevention, providing environments and systems that enable healthier behaviors can increase the actual impact on population health. I think it's easiest to illustrate this work by looking at the health impact pyramid. You may have seen this in several publications and webinars in the past. As you can see, the pyramid shows an arrow going down on the left that states increasing population impact, and an arrow on the right that states increasing individual effort needed. The base of the triangle is where the PSE work resides. And as you can see in that pyramid, it says socioeconomic factors as well as changing the context to make individuals' default decisions healthy. And I think that's where I see the automatic health playing out. It's here where we have the opportunity to make the most impact on population health. Where we are given the latitude by our funders and our leadership to focus on PSE change, it is absolutely effective and worthwhile to do so. The potential of this work to improve population health exceeds more traditional individual public health approaches. I'd like to share a few examples from Colorado in a few moments. Sometimes our funders and our leaders require us to focus on the top of the pyramid, and there's merit in that as well. But in these instances, Colorado has found success in pairing the top pyramid with the bottom pyramid, and I'll also describe an example of this further in our conversation.
Great. So can you describe the individual components of the PSE approach and then maybe highlight some examples?
Absolutely. What I'll do is I'll give a brief definition of each letter of PSE, and then I'll give a few examples. Some PSE change initiatives follow a continuum into other PSE changes, or they can be done in tandem. So the examples will illustrate more than one area. The P stands for policy and is defined as change in laws, regulations, or practices to affect positive health behaviors or health outcomes. These do not necessarily require passing of legislative policy, although that counts too. For example, legislation that prohibits the use of artificial tanning devices for minors. Policy changes or additions can be at the organizational level, school level, or local healthcare systems. The S in PSE is for systems change. systems change is defined as the change in a system that makes healthy behavior the default behavior or healthy choice the default choice. The E in PSE denotes environmental change and is defined as the physical or material change to the economic, social, or physical environment that promotes health and reinforces healthy behaviors. The first example I'd like to share where policy change leads to environmental change is one where policy change leads to environmental change. Colorado has had success in working with local communities to include health and community design or redesign efforts. Most communities have several guiding documents such as community master plans, transportation plans, park and recreation plans, just to name a few. By working with local officials, public health, public works, and councils, we have incorporated both active living opportunities and shade requirements into these plans. These plans are then adhered to by community designers and builders. This is an example where local level regulation or policy change leads to changes in the built environment. To share some details from our built environment work, one of the ways we identified communities that may need technical assistance in this area of the built environment for health was by completing a policy and resource scan and then overlaying burden data. There is a link that you can view to look at this data, and the link shows overweight and obesity burden in Colorado along with county municipal level policy and resource data. For example, does a comprehensive plan exist? When was it last updated? So you could use that by looking at that area of the state and saying, wow, they have a high obesity or overweight burden and they don't have a comprehensive plan that's been updated in the last 10 years. So maybe that's an area of focus for this kind of work. The next example is one that requires both policy and systems efforts. The Colorado Department of Public Health and Environment has been working over the past 4 years to ensure that patient navigation is embedded into health systems. While Colorado has had success in health plans funding patient navigation, there is much more work to be done. On the system side, there are efforts to integrate patient navigators into the healthcare team. This requires collaboration with health systems, payers, workforce, and other members of the healthcare team. When successful, patient navigators will have a clear value-added roles within the healthcare team so that all members of the healthcare team can practice at the highest level of their licensures. On the policy side, there is a need for legislation or regulation to credential lay or allied patient navigators to assist with the sustainability, legitimacy, quality of work, and the quality of work that the patient navigators do. The final example I would like to share is systems focused. Colorado has shown success through initiatives that originated with the Colorado Colorectal Cancer Control Program. This example will illustrate the top pyramid, bottom pyramid connection I referenced earlier. Some of the focus of programs like the Colorectal Cancer Control Program and the Breast and Cervical Cancer Screening Programs are individual-based, like individual screenings performed. We've paired this individual touch with clinic population-based systems changes. The guidance we've used to inform these efforts is the National Colorectal Cancer Roundtable, How to Increase Colorectal Cancer Screening Rates in Practice, a Primary Care Clinician's Evidence-Based Toolbox and Guide. Because that's such a mouthful, if you Googled NCCRT Physician's Toolbox, it would pop up for you. We have worked with FQHCs, safety net clinics, and clinic systems to implement systems-level changes for colorectal cancer. Based on the success of the colorectal cancer efforts, the efforts have expanded to include breast and cervical cancer screening programs and the Chronic Disease and School Health Grant from the CDC, which includes blood pressure, diabetes, and smoking assessment and referrals. This initiative provides the tools and the knowledge for clinics and systems to increase their clinic population screening adherence rates in a sustainable way, and we have seen success with this. As a summary, the efforts include provider assessment and feedback. This also includes getting a clinic champion, which is a very important component. Health systems intervention strategies. This can be office and policy workflow, standing orders, electronic health record modifications, reminder and recall systems, and staff training, and then of course continuous quality improvement. So it is important to reassess those screening rates regularly and systematically to ensure that you're meeting the goals and the needs that the clinic has. As you have heard, there can be a fair amount of overlap when thinking about PSE work. Is it a system or a policy change? Is it a policy change even though it will affect the environment? And I think the category of the definition is not necessarily important. Rather than asking if your efforts fit into the PSE model, I think you should ask instead, what is the impact of your planned efforts? Is it that you will screen 100 people for cancer? Or is it you will help make systematic and sustainable changes within clinics that will ensure 1,000 people are screened?
That's fantastic information, Crystal. Can you discuss the PSE logic model or framework that CDC developed to guide programs and really help them achieve their PSE changes?
Sure. The PSE logic model and framework are useful tools when planning and ensuring your work is on track. I think one of the most helpful documents when thinking about this work and looking how you might move it forward is to use the stages of coalition and PSE development figures. It's particularly helpful in helping teams identify when they're ready to move to the next phase, or perhaps when they're stuck in a certain phase and they may need to try a different strategy. So if you look at that figure, you'll see one of the first steps is building that strategic capacity, getting the leadership, the evidence, planning the evaluation, getting all the partners and the funding in place. And then there's getting that experience together, so stakeholder outreach, educating decision makers. And that leads to a variety of outcomes and impacts, which can be anything from community awareness to actually reducing risk for primary and secondary, for primary, secondary, and tertiary prevention.
Can you talk a little bit about CDC's PSE demonstration project and how it will or how it has informed future PSE implementation?
Absolutely. CDC's funded 13 comprehensive cancer control programs to increase capacity to implement PSE initiatives and to increase collaboration among traditional and non-traditional partners to implement these initiatives. Colorado is fortunate to receive an award for CDC's initiative to increase capacity to implement PSE initiatives and to increase collaboration among traditional and non-traditional partners in order to implement these activities. One of the most valuable components of receiving this award has been the connections that we've made to non-traditional partners. So Colorado started a Built Environment Strategic Collaborative, and if you Google that, you could find the Built Environment Strategic Collaborative, that's a tongue twister, on our website and see how the partners have pulled together to talk about that work. You know, anywhere from public health to public works, they're all in that room talking about how do they include health in built environment strategies moving forward. The evaluation of these programs will help the public health workforce better understand best practices for implementing PSE activities, barriers and challenges to program successes, the role of collaboration and coordination among partners to implement PSE activities, and the factors influencing PSE change. Evaluation will also help programs to assess how their collaborations can support PSE change, like in the example I gave with the built environment. The lessons from the evaluation will also be used to identify key components and lessons learned to help programs in the future. And in Colorado here, we've already built in a lot of our strategies into our comprehensive cancer grant and our work with the Colorado Cancer Coalition.
Now can you list some helpful resources that provide examples of evidence-based interventions or maybe some strategies related to PSE change?
Sure. Throughout the webinar, I've mentioned several resources and examples for PSE work, which I'm happy to be a contact for anyone that would like to have those links. And then in addition to the examples mentioned, there's a list of helpful resources which are from CDC-funded program. One of the most useful from the CDC-funded program is the MAPS, M-A-P-P-S. And it includes a list of evidence-based strategies drawn from peer-reviewed literature and resources on primary prevention of cancer topics. So there's the community guide, the MAPS, as I just mentioned, the United States Preventive Services Task Force, best practices for tobacco control programs, Morbidity and Mortality Weekly, or the MMWR, the Agency for Healthcare Research and Quality, Cochrane Reviews, Institute of Medicine, and one that I didn't necessarily put on the slide is Researched Reality, which is also a very helpful resource.
All right, and one last question. So why would programs, after they've reevaluated all of these resources, why would the programs adopt the PSE approach, and what could they expect from that?
So our population health issues are huge. If we were to focus on individual efforts only, there would never be enough resources to meet all the needs. So if we were able to focus on population health and systemic sustainable changes in addition to the individual efforts, we have a chance to make real changes, and hopefully in the not too distant future. Many PSE change activities are effective at the local community level, and it's important that we work at all levels, so local, state, and national, to implement PSE change. Promoting PSE change provides an opportunity for local health departments to reduce the burden of chronic disease within communities. It's an opportunity for communities to implement their community health improvement plans and for states to also implement their public health improvement plans.
Crystal, thank you so much for taking the time this afternoon and sharing your knowledge and experiences with our listeners. And listeners, please be on the lookout for more mini recorded webinars in this PSE Change series.